But I've looked at the statistics every day, clearly there's a ready to go. Good morning. I'm George Latimer, Westchester County Executive, and thank you for tuning in for our Facebook Live COVID Conversations. This morning, we're going to be talking with Michael Fosina, who is the president of New York Presbyterian-Lawrence Hospital, located in Bronxville. Michael is a local boy who made good. He's New Rochelle reared, but as a professional throughout the New York Presbyterian family of hospitals all across the region, and now in this position as the head of Lawrence Hospital, which also has a great tradition in the Bronxville community. Michael, thanks for being with us this morning.
Thank you, Mr. County Executive. I greatly appreciate the invite.
Let's talk right off the bat about how the community and the hospital have interacted. Having represented Bronxville in a prior iteration as a state senator, had a chance to get a feel for what the Bronxville and East Yonkers community is like. In fact, the area that Lawrence serves is much broader than just that. But in a difficult time, it appears that the community has really bonded with the hospital as you have with the community.
Yeah, the community partnership that the hospital has been strong and continues to grow strong. And it certainly has expanded the outreach that the community has to the hospital during this COVID crisis. Nothing short of remarkable. The number of letters, the number of cards that we get, the donations of food that come in for the staff have really been wonderful. At 7 o'clock every night, people drive by the hospital, beeping their horns in honor of the healthcare workers. So it's really been a wonderful outreach of support from the community, and certainly from our local elected officials, Mayor Marvin and the other mayors in and around the county that have been very supportive of us, as well as you and your team at the county level.
We have a terrific staff there as well, both the medical staff, the administrative staff, the nurses, all of the people that make up that family. Tell us a little bit about the family at Lawrence, and give us a few of the success stories that you've dealt with your team.
Sure. So in 2014, we became part of the New York Presbyterian system. And that has been a wonderful addition to be part of such a prestigious organization, and one that has ability to help out and move people around. With our Columbia partners, we've been able to add a lot of Columbia physicians to the Westchester community to make it easier, more convenient for the patients and the family members to get care from New York Presbyterian and Columbia and the services that we provide. So it's really been a great partnership with the college at Columbia, with the hospital, and with the county and with the local communities. And we're really seeing a growth in services and what we're able to provide for our patients.
One of the innovative programs I understand that you've really embraced is telemedicine, on-demand telemedicine. Tell us what that represents. Many of us who are lay people, hear phrases, and we understand that technology is advancing things in ways that it hasn't been before, but we don't necessarily know or understand the details behind it. So this would be of some interest, I think, for the folks watching.
Sure. Prior to the COVID crisis, New York Presbyterian had been one of the leaders in telemedicine, and we have an app called NYP On Demand that people can go to their app store and download it. And in doing so, they can click on that and get one of our physicians in real time to have discussions with them as to what they need, what they may need to do. If they need to come to the emergency room, do they need to go to a doctor? Do they need prescriptions? And that has certainly exploded over the last 8 weeks or so, as we're seeing many, many more people being more comfortable seeing a doctor through telemedicine than they were before this crisis occurred.
From the standpoint of what's happening in the hospital, give me some of the broad strokes of where you are in your plans with where you have Lawrence today. I mean, we're focused obviously on COVID. That's got everybody's attention completely focused. But there's a bigger picture of what you're trying to accomplish there, Lawrence. Maybe you can intersperse the two realities, the current reality and the bigger picture that you're trying to create there.
Sure. So the current reality is, like the rest of the state of New York and the county of Westchester, we're on the downside of the curve with the COVID crisis. We have less patients coming into the hospital each day with the virus, and we're discharging more on a daily basis. So we're starting to see that have calmed down, which is a wonderful thing that less people are getting. And I think all the things that have been put in place with the county, with the social distancing, with the masks, have all been wonderful, getting to their physicians early. So I think that has all been wonderful, and it allows us to slow that curve down. With regard to Lawrence, as a whole, on the broader spectrum, we have been adding subspecialists to the county that Lawrence didn't previously have. So we added a large orthopedic group from our Columbia orthopedists. We have neurologists and neurosurgeons now in Westchester. We built the cancer center. So we have surgical oncology, medical oncology, and radiation oncology all under one roof. So patients can go in and get that care and see all the physicians and the different specialties right in that location. Vascular surgery and general surgery have really exploded. So we're adding those subspecialists that we see are in demand for the county that we need to add to make it, again, as we said, easier, more convenient for the patients and their family members.
And give us an overview. When we talk about New York Presbyterian Lawrence and the affiliation or the relationship that's been created, tell us about what New York Presbyterian is as a family of facilities. We know that there are two others here in Westchester County, but it's obviously a much larger entity. Give us a sense of the scope of what NYP is.
Sure. New York Presbyterian System has 10 hospitals in the system and our two associated medical schools, which is Weill Cornell and Columbia College of Physicians and Surgeons. So together, the three organizations work to make sure that we're providing the highest quality care, research, and education for our medical students and residents, as well as providing that high level of care for the residents in New York metropolitan area and afar. Westchester County is fortunate because we have two hospitals in Westchester. We have the New York Presbyterian Hudson Valley Hospital in Cortlandt Manor and Lawrence as our med-surg hospital, but we also have our behavioral health facility, which is in White Plains. We have medical offices with our New York Presbyterian medical group scattered throughout the county, the northern part of the county and the southern part of the county. And we have Columbia doctors and Weill Cornell physician offices all throughout the county. So somebody in Westchester County could get to one of our doctor offices within 10 or 15 minutes of their home. And they have opportunities to see our doctors there. If they need to be hospitalized, we have New York Presbyterian hospitals in Westchester County. And if they needed to have care at our academic medical center, we would transfer them down to our academic centers in the city, which is part of being a part of the big system, is we're able to move the patient to where the services are in an easy, more efficient manner.
From the standpoint now of the COVID crisis, there are obviously certain protocols that we as laymen have to follow. Just go through it one more time for everybody's comfort level. Everybody's reminding, these are things mom told us years ago. We may or may not have paid attention now, but maybe we're paying attention because of COVID.
Well, we certainly, people are paying attention now, right? So as you see, the orders are, we are wearing masks outside to protect ourselves as well as others. The shaking of the hands has been slowed, and your fist pumping or elbow pumping nowadays. The social distancing is important because that's how the virus is spread. This is a very contagious virus. So keeping apart from each other, while hard and while, as it goes on, more difficult, but it's something that we have to do so we can get through this crisis as best that we can.
We've been talking with Michael Fosina, who is the president of New York Presbyterian Lawrence Hospital. Michael, we know you have a very busy day, lots to manage in the hospital. So we thank you for your few minutes of time, and hopefully the folks who see this will get a little better understanding of what you have to go through every day in your line of work, which is on everybody's mind right now. Thanks again for the time.
Great. Thank you very much. I appreciate the time. Have a good day.
Again, Michael Fosina, president of New York Presbyterian Lawrence Hospital. We'll be back at 2 o'clock for our daily update of issues related to the coronavirus. We'll be based over at our warehouse for emergency services, again, where we have another significant charitable donation of PPE that we'll highlight while we're together. and we'll try to give you the latest information and any updates on any of the other things we're working on. This is George Latimer, County Executive. Thanks for watching. See you at 2 o'clock.